Hello there, welcome back to Christian Ethics and Healthcare. I hope you enjoyed last week's introductory discussions. Now, this week we'll take a general look at the field of ethics as a scholarly discipline and introduce you to some of the basic organizing concepts in ethics. Why do we have ethics as an intellectual discipline? Well, to put it simply, ethics is necessary because our values, or the things that we find important and hold sacred, often come into conflict with one another. How do we balance, for instance, our friend's well being on the one hand, with her freedom to make her own life choices? How do we balance the welfare of society as a whole with the liberty of individual citizens? This latter question became more than just hypothetical when it was shown that vaccines are effective in eradicating diseases that have plagued humanity for many years. Smallpox, polio, and measles caused hundreds of people to die in the past, but because of state-enforced vaccination programs, which some people resisted, many of these diseases are nearly eradicated in many parts of the world. However, should something life-saving always trump the freedom of individuals? In our personal lives, we also have to think about whether the welfare of our children, our friends, take precedence over their freedom to make their own individual life choices without our intervention. These and many others are questions bioethicists look at. From the beginning of the Western medical profession in ancient Greece, it became very clear to the providers of healthcare, as well as to potential patients, that without some moral guidelines, medicine is bound to repeatedly succumb to chaos and disasters that will undermine both the patient's health as well as trust in the medical profession itself. So, if doctors and nurses cannot be trusted, and really there's no standard of any kind of professional competency, then the entire medical profession and the institution itself would collapse. So, this is why the Hippocratic Oath, for instance, was developed. Uh, it outlines the basic duties a doctor has to his patients, such as patient confidentiality, to do no harm, as well as some moral virtues, such as reserve, scholarliness, and seriousness. Later developments from the Judeo-Christian heritage elevated the moral seriousness of the healthcare profession by the high standard of the commitment to not abandon patients, even when confronted by tremendous personal risks. And since the human rights movements in the 1960s, which emerged after the disastrous history of human experimentation in medicine, healthcare professionals also started to take patient autonomy, that is, their ability to freely refuse treatment and to decide what is best for them, very seriously. And since the 19th century, the American Medical Association also developed professional standards that excluded non-scientific approaches of medicine from the profession itself. However, none of the codes of ethics that we looked at so far make much sense unless they can withstand some kind of moral criticism, right? The field of ethics tries to bring philosophical reflection to bear on these moral questions by examining the basis of our ethical attitudes and by asking whether we have good reasons to hold the views that we do. General normative ethics deals with frameworks of ethical judgment, or what we call ethical theories. We will take a look at some of them next week, some of the ethical theories. These theories help us to make sense of our ethical intuitions. They ask questions like, what is it we take to be the most valuable things in life? Is it pleasure? Is it wealth? Is it happiness? Is it the pursuit of truth? Is it pursuit of excellence? Or is human life in itself the most valuable or sacred thing? As we have seen last week, does an android like Data have moral standing? That is to ask, should we treat an android like data with the same respect that we show to other human beings? Now, if so, what is the basis of that judgment then? Well, the answer to these questions have huge implications for how we treat animals, for instance, or even fetuses. Ethical theories confront these types of questions head on and try to make recommendations on how our values should be organized and how they might be applied to specific situations. Again, we'll take a look at some of them next week. Applied ethics makes use of some of the insights of ethical theories in order to make ethical decisions in very specific contexts, like in business and healthcare and so on. The results of ethics are often taken to be normative. It means that it's applicable to everyone universally and objectively. So before we go into the applied ethics part of the course, we'll be looking at some ethical theories in the next few weeks. I hope you have enjoyed this week's discussions.